Good afternoon, and thank you for joining us today. You're watching Ask Us Anything About Cholesterol Screening. I'm Barbara Shindo. According to the American Heart Association, nearly 1 in 3 of every American adult have high levels of so-called bad cholesterol. Bad cholesterol can contribute to fatty buildup in the arteries, ultimately heightening your risk of heart disease, heart attack, or even stroke. But there's good cholesterol and bad cholesterol. It can be a little bit confusing. What's the difference? And how do you know your levels of each when you should be concerned? Lucky for us, joining us today, we have an expert to help us figure all of this out. Dr. Patrick Fitzsimmons is an interventional cardiologist with Penn State Health. Dr. Fitzsimmons, thanks so much for joining us this afternoon to talk about this.
Good morning. How are you guys?
Good, good. And I want to say for anybody who's watching this with us, whether you are watching this live or you're watching this on playback and you have a question about cholesterol screening for Dr. Fitzsimmons, please feel free to put your question in the chat right below this video and we will get an answer for you. So Dr. Fitzsimmons, we'll start with the basics. What is cholesterol?
Cholesterol, basically, at the basic sense, is just kind of fat running through the bloodstream. It's the best way to look at things. And that's broken down into many, many different avenues. It's certainly affected by what you eat and what you do, but your liver processes the food that we eat and then kind of puts out all this kind of fats into the bloodstream. Now, fats in some ways are good because you do need that for your brain to function, for your heart to function, your body to function. But ultimately, like high levels are deleterious to the arteries of your heart, which is kind of where the blood is flowing through and really puts you at risk for heart attack and stroke.
So let's talk a little bit more about this, as you said, there's both good fat and bad fat, which would lead me to believe that if cholesterol is fat running through your body, that there's both good versions of it and bad versions. So what's the difference between good cholesterol and bad cholesterol?
So good cholesterol is, if you get your blood test, it's the HDL, and those are what's called high density lipoproteins, and they actually remove fat from arteries from the body. So, your HDL, your good cholesterol, you always want it to be high on your cholesterol screening or your panels. Bad cholesterol, or LDL, is low density lipoprotein. And that actually deposits. So when you have high levels of LDL, that will deposit into the arteries. And that's the bad thing that leads to strokes and heart attacks. If you think about it like the plumbing in your, in your kitchen, it's kind of like rust development on the pipes. So ultimately, you get too much rust, it can impede the flow of the water and, prevent pressure from building up into the system, and therefore if it breaks off, then it can cause problems.
I'm glad that you already mentioned a term I was going to bring up, which is high cholesterol, but you mentioned it in relation to good cholesterol. So if people hear the term high cholesterol, they might think that means it's automatically bad, but the term high cholesterol doesn't necessarily mean it's bad.
That's correct. So, it's actually, you get, when you have a lipid profile that's done, they give you a total cholesterol reading, right? So a lot of people will get like freaked out. Oh my gosh, my total cholesterol is way too high. And and they're losing their mind and they come in and they're in panic mode. But then it really gets down to like the breakdown of that. So I've had people that have high cholesterol, but total cholesterol, but their good cholesterol is so high, it's a negative risk factor for heart disease. That's actually a good thing. So I've had some people come in that are panicked because their cholesterol is 250, but it's really driven by their good cholesterol. And I tell them, well, you might be able to go out tonight and actually have a cheese fries and a steak sandwich, because I think you're going to be okay. Other folks come in obviously with the high bad cholesterol, then it's a different discussion.
Mm-hmm. So when you, sorry, I got sidetracked by my own thoughts here. When you are saying when people have too much bad cholesterol, what does that mean? What does it mean what are the risks associated if you're, you get your lipid panel done and your physician says you will have really high levels of the LDL or the the bad cholesterol? What are the risks associated with that?
Yeah. So the bad things about, LDL or bad cholesterol levels, the higher the level is, the higher the risk. So, and we've determined that over time, depends on what, your risk factors are. And if you've had prior heart disease, kind of what your level should be. But the higher the level, it promotes not only deposition of plaque in the arteries, which is that kind of rust that can occur inside the pipes, but also it, causes inflammation. And we know that inflammation is also a process that promotes, both heart attack and stroke. So the higher the level, essentially the higher the risk.
Okay. And Dr. Fitzsimmons, we do have some questions coming in the chat from some of our viewers here. So the first question we're going to take is from Robin, and Robin is wondering. She said, "My LDL is 141, and my HDL is 160, total 220. Are these numbers concerning?" I know you probably don't treat Robin directly, but would these numbers?
Yeah. So you're in the level for. I'm assuming like some of these things are assumptions, right? So I'm assuming you don't have diabetes, assuming you don't have heart disease. Or a prior stroke. So your level, what your goal would be with the LDL is 130. So really you're not that far away. So is it alarming? And like, would I be like overly concerned? Like, oh my gosh, you need a lot of medicines and things like that? Not necessarily. Like with where that level is, you could probably manage with conservative management, depending on your diet, and then exercise, and a lot of people don't realize that, diet and exercise can have a risk reduction of up to 25 to 30%, almost as much as medications. So if you think about that, you're, 141, if your goal is 130, by really following like a Mediterranean diet and trying to, walk up to 45 minutes a day of continuous walking, you're going to get to goal without adding medication to your, that's something that you have to take every day. So is it alarming? No, it's okay. I think it's like a lot of us. I struggle with the same things, right? I struggle with my diet. I struggle with exercise. I'm no different than anybody else. It's kind of like preaching to the choir, right? But, so there's a little bit of work to do. Is it super alarming? No, I think that, you can probably get there with some mild, lifestyle modifications.
Okay, Dr. Fitzsimmons, thank you for that, and Robin, thank you for your question. And I agree with you. It's hard. We all know that diet and exercise, having regular exercise and trying to eat healthy is always good recommendations. But I, just like you and probably everybody else, sometimes it's hard to say no to the pizza, the cheeseburgers.
We all struggle. I mean, it's funny. Patients that come in, I feel like I'm no different than anybody else, right? Even though I deal with this every day, the challenge that I have is the same thing. Like, you're working a 9-to-5 job, or you're, trying to pay a mortgage, and you got kids running to soccer practice or ballet or whatever. And, you're trying to like do all these things. And unfortunately, a lot of times health of ourself is put on kind of the back burner. And I always tell people, it's challenging. You got to move that up the line so that, take care of yourself so that you can take care of other people in your family.
Thank you for joining us and watching Ask Us Anything About Cholesterol Screening with Dr. Patrick Fitzsimmons, an interventional cardiologist at Penn State Health. If you are watching this, whether you're watching this now with us live or you're watching this on playback, and you have a question about cholesterol for Dr. Fitzsimmons, just please type your question in the comment field below this video, and we will make sure to get an answer for you. And also, please feel free to share this video. So anybody who may be concerned about their cholesterol or wondering how to get a cholesterol screening, this can be very helpful. So let's go back. We were talking a little bit about diet and exercise, and I think that will relate right to another question that we have from another viewer here, a viewer named Steve. And Steve is asking, he's asking specifically about energy drinks, but I think this can also speak a little bit wider to diet. Will this affect cholesterol if you drink energy drinks or
believe it or not, you're going to get a pass on energy drinks. Energy drinks has low effect on cholesterol. The biggest effect with energy drinks is going to be on blood pressure, raising blood pressure, which is a risk for heart disease, and potentially, depending on the glucose content of the energy drink, you could affect obviously your sugar and potentially diabetes. So those are the biggest factors with an energy drink. But cholesterol itself, probably not going to have much effect on it.
Okay, that's good news. Good news for the energy drinkers, as at least related to cholesterol. So let's talk about when you should start getting screened for. When should you start getting regular cholesterol screenings, and how do you go about doing that?
Yeah, usually, believe it or not, it's actually fairly young. So heart disease kills about 1 in every 2 Americans, both men and women, which is a lot, right?
Yeah,
so,
that's a lot.
And if you think about it, Barbara, I'm going to pick on you a little bit because, women usually know, women are great about this, right? They know that like breast cancer kills people too, right? So you get a mammogram, right, as a screening test. And, most women will know like breast cancer kills 1 in every 8 women, but in heart disease, it kills 1 in every 2.
Wow.
We don't have a mammogram, right? The only thing that we actually have is cholesterol screening. So typically, the recommendation is earlier is better. So typically as young as 25.
Wow.
So
I started getting screening. I think it was my early 30s is when my PCP said, it's time to start getting your regular.
Yeah, and cholesterol will kind of go up as you age. So just getting one done and being like, oh, it was 15 years ago and now I'm fine is not the right answer. So, once a year is probably reasonable, certainly as we get older, above the age of 30, 35. But it also depends on your family history. Like if you have a family history for, early heart disease or hyperlipidemia or cholesterol problems, you should be screened at an earlier age.
Okay. And for the folks who are watching this, who maybe don't see a regular physician, they don't go for yearly checkups, would you recommend that that's, something they start doing?
Yeah. I mean, I think that, the good thing about if you find something early, you're less likely to see me. That's the way I put things, right? So, if you're seeing me in the emergency department, it's probably not the best day of your life. It's probably better to get screened both for blood pressure, get screened for diabetes, and get screened with lipids, at least, once a year with your primary care physician. I mean, that's going to really help to prevent things. I mean, in America, we're not great with prevention. But doing the right things, if you found, like I said, cholesterol lowering, if you get it either down with diet and exercise or with medications, your risk reduction for stroke and heart attack is upwards of like 25%. So that's just with exercise and diet, right? So if we add medications to that, your risk reduction is in the 40% range. They're additive. So that's a profound impact on one's health when you're talking about lowering the risk of both heart attack and stroke.
Mm-hmm. So. And I feel like we have been hearing so much lately about, exercise as medicine. Exercise is a very important prevention tool. So I'm glad that you brought that up.
Yeah, it's important too, because believe it or not, when you exercise, there's a lining of the arteries called the endothelium. And studies have been shown that when you exercise, it basically conditions the endothelium. So it makes it just like working out. It's going to have less blockages. It's going to be more reactive as you get older, lowers blood pressure. So exercise has a huge, profound impact on patients' longevity as well as their risk.
Okay. And I want to go back to another part of the answer to our last question. I feel like we're on the same wavelength. You keep saying things that I'm already thinking of asking you in part of your answers. So you said something like, it's better to get screened before people wind up seeing you, before they wind up seeing you in.
I like seeing people, but usually it's scary, right?
But yeah. So my question is, when is it that somebody should be concerned to the point of seeing a specialist, an interventional cardiologist like yourself?
Yeah, I think it depends on a lot of things. One, obviously symptoms, with men, it's, typically easier. Men follow the textbooks, kind of chest pain, shortness of breath, radiation down the left arm. With women, a little bit more challenging. Women don't always follow the textbooks. And we know that, women present later. They're usually misdiagnosed more often. A lot of times it can be just shortness of breath or change in the ability to exercise. That's why exercise is also important. I tell all my patients, get out and walk around the track. You don't have to be a marathon runner. You don't have to be Arnold Schwarzenegger. But if there's a change in what you're able to do one week to the next, that could be an indication that something's going on, right? And that might prompt you to say, hey, I either need to go into primary care, or, hey, I need to see Fitzsimmons, right? So, those are the things that are triggers that you should see a healthcare provider.
Mm-hmm. Okay. You are watching Ask Us Anything About Cholesterol Screening with Dr. Patrick Fitzsimmons, an interventional cardiologist with Penn State Health. If you have a question about your cholesterol or cholesterol screenings for Dr. Fitzsimmons, please feel free to put it in the comment field right below this video. Whether you're watching with us here live now or you're watching this later, we'll get an answer for you. Speaking of exercise and medications and those things, we have a question that came in from Kathy. And Kathy's question is a little specific, but I think we can broaden it out about medications. So she has some stats here. She has a 53 LDL and HDL is 124. She has tried 4 different statins. Is statins the type of medication that you would take for high cholesterol?
Yeah, so statins will have a tendency to lower LDL, and they will actually lower your total cholesterol. So a lot of the statins will lower total cholesterol, HDL, and LDL. And the profound benefit, obviously, with regard to events is lowering the LDL or the bad cholesterol. So statins are good. We also have newer injectable agents that if statins do not work for you, which have just come out on the market really in the last 5 years, that are really good as far as a lot of people have side effects. So 5 to 8% of people have muscle aches and pains. They don't want to take the statin. There's a lot of bad press with, is there an association with increase in risk of diabetes? Is there an increased risk with dementia as people get older? So we do have other factors or other methods that we can do in addition to statins. Statins have the best data as far as not only safety, but long-term survival and risk reduction. So that's where a lot of people start with statins. Typically, I get people that have either failed statin therapy or they are intolerant of statins. And then people usually get referred to me for that.
So there are options for folks who aren't seeing the kind of results that they were hoping for on statins.
Correct.
Okay.
Yeah, HDL is probably the one to treat. When your HDL or your good cholesterol is low, there's really not a good medication for that. The only things that have really been shown to help it is exercise will help to raise it about 10%. And then also, believe it or not, low dose alcohol. So I don't want to tell everybody to go out and drink, but 3 either beers a week, red wine, a glass of red wine will help to raise your HDL. And that's probably some component as to why you've heard that in the press that red wine, makes me live longer. There is some truth to that.
Wow. You guys heard it here from Dr. Fitzsimmons.
I'm the only person have a drink,
No, that's interesting information to know. And that's if that's something that might be helpful, I mean, why not give it a try? And Dr. Fitzsimmons, we do have another question that I think is pertinent here. Jennifer is asking, what can I do to increase my HDL, to increase my good cholesterol? What can people do?
That's just right down what we were talking about. So HDL is the hardest thing to raise, believe it or not. We don't have a medication that's approved right now to do so. So, exercise can raise it 10%. Red wine or, 3 to 5 drinks a week, not a night, and not this kind of drink. Okay.
A good clarification to make.
Exactly. So either, a shot of alcohol, a beer, or a single glass of red wine, 3 to 5 days a week will help to raise HDL about 8 to 10%. So those are the only things that we really have right now that will help it. When you have a problem with really low HDL, it is a risk factor for heart disease. The other strategy that we typically have with really low HDL is to drive the entire cholesterol down, and that will lower risk. And typically we use the cholesterol statin drugs for that.
Okay. Well, Dr. Fitzsimmons, thank you so much for making the time to talk with us here today. I learned a lot. I thought this was really interesting and helpful. And I can't believe I just realized I forgot to mention it's Heart Month. So
It's Heart
there's
Month.
a reason why we're
Red
talking
time,
about
right?
this now. It's very timely. So, and as you had mentioned, heart disease is very serious and affects a large number of people here. So very important information to have. So thank you for those of us for watching. Ask us anything about cholesterol screening. If there's something that we missed in our chat here that you didn't get answered and you're still wondering, please still feel free to put your question in the comment line here below the video, and we will get an answer for you. And again, Dr. Fitzsimmons, I really enjoyed talking with you. So thank you for joining us today.
Thank you. Have a good afternoon, guys.